We were approached by Hospice Care of the West asking if we would consent to doing a video interview with my dad. My parents were both in the military. They were both very proud of their service. My dad said the most important thing in his life was his family. The video was just a real gift to our family.
Well, joining us now on the set is Hospice Care of the West, and joining us in particular is Deb Patricio and Vincent Wynn. Deb is actually the Director of Patient Care Services, and Vincent Wynn is the Director of the CARES program over there with Hospice Care of the West. Thanks so much for joining us today on the program. Now, we're going to be talking about something that I'm sure a lot of people have not heard of, and that is POLST. That's a new acronym I haven't heard, so tell us a little bit, what is that?
POLST, like you said, is an acronym. It stands for Physician Orders for Life-Sustaining Treatment. And it is basically a tool that we use for patients who are seriously ill or have serious illness. And what the form does, it helps translate what's important to the patient into an actionable physician orders that tells exactly what patients' wishes are when it comes to the kind of care they want at the end of life.
Is it similar to the advanced directive then?
It is similar to the advanced directive. However, the advanced directive sort of project what would patients would want in the future. But the POLST is really meant for people who are serious illness. And what it does is it transforms it into an actionable order. It's something that can be done rather than something as nebulous as something toward the future, years on end. I think we need to clarify that for you a little bit. With advanced directive, of course, is you get to assign who will speak for you when you can't speak for yourself.
Right. So what is included in the form? Is it like who's going to take care of the house, who's going to take care of the financial aspects? Is it something like that, or is it more of a medical form?
The POLST is more of a medical form, and it's divided mainly into sections whereby, we talk about whether or not patients would want resuscitative effort in the event should their heart stop, and then whether or not they would want to have a tube down their throat or put on ventilators when they stop breathing.
Right.
Or whether or not they would want tube feeding or artificial feeding if they can no longer swallow at the end of life. And these are some of the issues that we don't typically talk about, but it's so important that we have these kind of conversation way ahead of time. Absolutely. Rather than waiting at the last minute.
So if I have a family member and they have the POLST form here and the advanced directive form, which one do they work off of?
Well, whatever is more current. So typically, usually the advanced directives are done months and years ahead, and it's usually when people do it when they're relatively healthy. And the advanced directive is meant for anyone older than 18 years of age. So basically with advanced directive, you will assign someone who will speak for you when you can no longer speak for yourself.
Right.
Whereas the POLST is something that it's meant for people who are pretty sick, seriously ill, that they need to transform the advanced directive into something that's actionable, something that the doctors, the emergency room physicians, the paramedics will know what to do. And I have scenarios and stories whereby patients, did not want resuscitative effort on an advanced directive, but then when it came to the point where, when they had stopped breathing, at that moment, the instruction on advanced directive is not clear enough. So what they would do is they would do compressions and put tubes down patients' throat. The patients end up in the ICU. And families will often ask, why was this done? Right. Well, because the advanced directive is not clear and specific enough, whereas the POLST, it is very, very clear. It spells out exactly what the patient
So
want.
they are both legal documents that the family member would present to a doctor or a hospital during this time?
Yeah, well, just to give you an example of looking at the difference between the two forms, this is the California Advanced Directive form, and you can see it's multi-pages. And this requires either a notary or two witnesses to sign it. And as Dr. Nguyen said, this is really more for someone of any age who wants to designate who should speak for them. The POLST is very simple. It's a single form, front and back. It's basically the front gets completed, And as a physician order, it is a legal document. It's protected by law as far as any healthcare provider needs to follow what's on here when it's fully executed, meaning it's signed by a physician and by the patient or the patient's surrogate decision maker.
Who completes that form? Is it the person that is suffering?
Well, it can
Could be a
be
family
it can
member?
be the individual. If the individual lacks capacity, it would be their surrogate decision maker or closest relative, and it's usually completed by a healthcare provider, preferably the patient's primary care physician, who would know them best, or it can be completed by a nurse or a social worker.
So does the person that is suffering, are they the signature on that form then?
Yes. Yeah,
Okay.
it would be the patient's signature or their surrogate decision maker and the physician's signature as well.
Yeah, in order for this to be a valid document, essentially, you need to have signatures, and it's because it's a physician order, you need to have a physician's signature, but then this is the only form whereby the patient, if the patient cannot sign for himself or
Right.
herself, it would be their durable power attorney or the designated person who will speak for the patient.
So where would you keep a document like that? Do you keep it on the refrigerator if a paramedic or somebody comes to the home?
It's a great place to keep it. I mean, someplace where it's clearly visible. This form stays with the individual. So ideally, it would go, if they were to go to the hospital, it should go with them to the hospital. But it stays in the person's possession, and on the refrigerator, on a nightstand, someplace where it's clearly visible.
Right.
So anybody coming in to provide care would know that it's there. And of course, with this lovely bright pink color,
Right.
it's pretty easy to spot.
Right. And where can you get a form like that?
The website is called capolst.org, so it's capolst.org.
Okay.
And anybody can go on that website and download a form from
Okay.
there.
That's CAPO Pulse, right? So it's
POLST.
POLST.org. So be sure and write that down. Again, that is www.capolst.org, and you'd be able to pick up that form. And then same with the advance directive. That's something you can get online as well?
I believe so. I know in our organization we have both of these forms available for our patients. It's part of our admission packet.
Okay. If you were to fill out this form and say, now your family member has maybe moved you to another state, is the form still in place and is still a legal document even though they've maybe changed residence to another state?
Well, the PULSE is a legal document here in the state of California.
Okay.
So what it does is it protects the physician in terms of, I'm obligated to follow what's on this course, this form. However, the patient moves to Arizona or so, the form is not a legal document in that state. However, having a tool such as this will help the physicians, help the paramedics, will say, oh, it looks like the patient had this type of discussion before.
Right.
And I know at this stage, Arizona is working on their own form that mirrors pretty much what is on this pink PULSE form that we have in California. So this is not just only an Orange County effort, but it's a national effort in all the states in the union to make sure that we have a tool that is transferable from one
Right.
setting to the next.
Yeah, and obviously the form is filled out, so there's intent. So if someone was to read the form and they had it on their person, then hopefully people would take the advice of the form and do what the person hopefully had requested.
Mhm.
Very interesting. So obviously this is for somebody that, like you said, is seriously ill. So are we talking within a year of passing?
Yeah, typically the PULSE is meant for people with a prognosis of 12 months to 18 months if the illness follows its normal course, because it's hard to predict. However, we need to make sure that we have these kind of conversations. People who are in frail health, they need to express to their family, to their doctors, what's important to them.
Yeah.
Because oftentimes, because I work at Hoag, and our CARES program is from Hoag, not with Hospice Care of the West. I just want to clarify that. So I work in the ICU. I take care of very sick patients, and oftentimes when we care for patients, we see patients ended up in ventilators and intubated and on multiple medications. And the families aren't always sure that, I wish mom would have talked to me about what she
Right.
wants, because I'm not sure what to do.
Right.
So, you can spare the anguish to your family, to your loved one, by expressing to them, this is what I want. I don't want treatments that will necessarily, we want treatments to prolong people's lives, but we certainly don't want treatments, people oftentimes don't want treatments that prolong their dying process,
Right.
prolonging their suffering. They want their wishes to be respected, and I really believe the PULSE will capture that and to basically engrave that somewhere so that people will understand this is important to me.
Yeah, and it's important too because once you have different family members in a situation like you're in, you know, the son might want to have it one way, and then the daughter who's been taking care of the mother maybe might want it another way. You have family members in the waiting room, you know, having these discussions when, like you said, that conversation should have happened quite some time ago.
Absolutely.
And that's the hardest part, is having that conversation, because, you know, then you realize that, you know, this is a period of life that's changing, so, but it's important that we have that conversation. Great. Well, Hospice Care of the West, you've been with our community for some time now. Tell us quickly about where you're located and some of the services you provide.
Our main office is in Anaheim. That's our primary location. We provide hospice services throughout all of Orange County and LA County. So our service area extends about 60 miles out from the main location in Anaheim.
Right.
And we provide services, hospice services to patients in their own homes, if they're living in a board and care facility or an assisted living, you know, wherever the patient calls home, that's where we provide care.
Very good. Well, if you, first of all, what you need to do is fill out this form, and you can find that again on www.capolst.org, or give them a call there at 1-800-405-1159, and they'll be able to give you that information as well. Very important information to fill out this form and have that conversation. You know, even if it's you that needs to initiate it with your children or your grandchildren or whoever's taking care of you, the conversation needs to begin, and then to fill out the form and have that form available with you, you know, basically everywhere you go, right?
Yes,
Very
absolutely.
good. Well, this has been some very good information. Thank you so much for bringing it to our community. And we do encourage people to go to that website. If not, give them a call at 800 number 405-1159, and they'll be able to help you out as well. Or go to hospicecareofthewest.com. We'll be back with more of This Day right after this.
It was the most wonderful, sweetest 2 hours sitting in the sun, letting Mom tell stories. She was a pilot during World War II with the Women's Air Force Service pilots. Hospice Care of the West really helped us find a way to find joy in all of this. And that video, it's a gift that we've not just given her, it's a gift we've given ourselves.